Today we are so fortunate to have Dr. Jani van Logem, one of the world's most famous aesthetic physicians. He is also the founder of the UMA Training Institute in Amsterdam, and this is one of the most famous centers in the world today for training for non-invasive aesthetic treatments. So fortunate, Dr. Jani, that you've come and visited us here at Cutis Medical Laser Clinics. My first question is, what do you like best about Singapore?
Well, that's very clear, the food. Yes, because you have such amazing variety of all these amazing Asian kitchens over here.
Yes, no, that's...
And the people that I've met here were also very passionate in sharing how they love their food here. So I've been gaining some weight, because of all these delicacies that I've been trying.
That is fantastic. Now let's talk about business. First and most important for me, for the Merz portfolio, the calcium hydroxylapatite fillers. What do you believe makes this very special?
Well, calcium hydroxylapatite is probably the most versatile filler on the market. You can use it for structuring the face, like a chin, like projection, nose, cheeks, but you could also use it for volumizing. So if you inject it deep in the deep fat, you can volumize the face, and you can also use it for skin quality improvement. So if you dilute it with saline, then you can have a very thin film of calcium hydroxylapatite in the skin that is losing collagen, and then the product will actually stimulate the tissue to become firmer and to tighten.
Yes, and I saw an image yesterday that you presented where the lady who had been receiving the treatment for 6 years straight actually looks 10 years younger than when she started.
Yes.
So that was very impressive.
Yeah, so it's a regenerative product, and that is really the essence of that, because we stimulate the tissue to become healthier, and therefore it looks younger. Yes, even though she gained 6 years, she also lost some visual years.
Amazing. My last question. We know that combination treatments create the best results. How do you propose combining botulinum toxin, calcium hydroxylapatite, hyaluronic acid fillers, and microfocused ultrasound with visualization? How would you combine this in working on a patient?
So ideally, I would do the microfocused ultrasound with visualization first. It's important to have the visualization because you can really specifically target the structures that you want to target, so like the SMAS, for example, to give that lift. So you have to visualize it, and then you can actually focus that energy on there, so you can get the tightening of that SMAS. And if you do the microfocus ultrasound, then after that you could do the injections, and this is when you do it on one day.
Right.
But what I have been doing actually recently is first inject calcium hydroxylapatite, then 6 weeks later do the microfocused ultrasound with visualization. And the reason for that is that with the calcium hydroxylapatite, we've learned that there's a proliferation of the fibroblasts. So there's more fibroblasts that are more active, and then you do the microfocused ultrasound, and you get actually not just a addition, but it's a
multiplicative.
Yes, exactly.
Yeah, that is a great process and actually protocol, and we will try that. Now, and I know I said that was my last question, but just we're about to treat a gentleman. What do you say in big broad strokes, the key differences in treating a lady versus a gentleman with dermal fillers?
Yeah, so it's a huge difference, and we've all seen the examples of how a man gets a feminine treatment approach, and that looks really bad.
Yeah.
So in order to think about the differences, a woman should look beautiful and soft, and so we accentuate basically the fat tissue. Of course, healthy skin is important. You have a beautiful glow in the skin, but we essentially we stimulate. We inject some products into the fat compartments.
Right.
And with men, to accentuate masculine traits, we accentuate the bone and the muscle, right? So not so much the fat, but so you have to have like a really good strong jawline, maybe some sharp cheekbone, right? Straight nose, and we accentuate the muscle. So a good masseter muscle is really attractive, looks powerful in a man. Also temporalis muscle, to have not so hollow temples, but like a good strong temporalis muscle makes a man look powerful, confident. And if you think about like brow shape, with a woman, it's beautiful to have this really open, arched brow.
Yeah.
But with a man, even though it may make him look less tired, with a man it's much more interesting if he has more horizontal brows, because it makes him look more intense, and actually more interesting.
Yeah. Final question, Dr. Jani. What do you see are the most important trends for aesthetics?
Well, if you walk around Singapore, in Orchard Road, you look around you, you see these overfilled faces, right? And we start to realize, okay, all these milliliters of hyaluronic acid are being injected into these people. That doesn't make them look attractive. It makes them actually look a little bit more insecure, because they're trying to hide like their true selves. And I think we're moving much more towards what you're really good at, is biostimulatory products, like microfocused ultrasound with visualization that will create such a beautiful natural lift without actually injecting volume. And also products like calcium hydroxylapatite that will stimulate the tissues to actually become more healthy and to produce collagen. I think that's a real trend, and especially the combination of these two. And what has been like lately, what has been really becoming popular, and you probably see that happening a lot, is blending the calcium hydroxylapatite with specific hyaluronic acid products with CPM technology. And because that has now, in some case reports, shown that it's very safe, very effective, and amazingly long-lasting.
Right, that's really great. So in terms of trends, I do agree that overfilling is out. And one of the concerns whenever we go to these international meetings is the physicians ourselves look overfilled.
Yes.
And that becomes really dangerous as we treat our patients.
Yeah, I think we have a responsibility to also show our patients that we also accept some flaws.
Yes.
We wear them with pride.
Nice.
We don't have to try and polish all these little wrinkles away.
That's wonderful. Although looking at you up close, you're perfect. Well, that's really great, and I appreciate you again visiting us. I hope it's not another 10 years before you come back to Singapore.
I will be back much earlier than that.
Thank you, sir. Thank you.
Thank you very much for having me here.